Hey everyone, we are here at Kingsport Pediatric Dentistry and I'm joined by Dr. Helderman. Dr. Helderman, thank you so much for having daytime here.
Thanks for coming.
Yeah, of course. So I have to say, right when I walked in, the bright colors in here just makes you so happy. Tell me a little bit about the space here and of course what it is that you all do here at Kingsport Pediatric Dentistry.
Well, we're a pediatric dental office, so we specialize in seeing children from infancy all the way up to the age of 18. So what that means is I went to an additional 2 years of schooling, that we focus just on seeing children, how to cope with their anxiety and how to treat them for special situations. But we walk in the door, it's bright and colorful. We have TVs everywhere and iPads for the kids to play on. We have a system called Beam. It's an interactive gaming system where kids can jump around and play. There's like a video game on the floor. Gets their energy out before they come back here and we do their cleanings. Then we come on back and it's just lots of bright colors, TVs on the ceilings. Again, we have iPads and stuff in the treatment bay, so it just kind of keeps them relaxed and makes the treatment a little easier.
Right, and I think going back to what you were saying about your schooling, you not only had to obviously do the dentistry work, but then also learn how to work with kids and make everything here kid friendly and of course help ease those anxiety of these little kids coming in maybe for the first time.
Yeah, it's just, I mean, it's different with children than adults. You know, you kind of have to play and make it fun and interactive, and that's kind of the 2 years we spend just solely working on kids, learning to work with special needs children, learning techniques and procedures and focus on those that we would do with the kids that you don't typically do with adults. So we spend those 2 years specializing in that, and then it makes for a fun, easier environment for the children when they come in.
Definitely, and you mentioned that you work with kids of all ages from infants to 18 years old. And with infants you see a lot of maybe mothers that are struggling with breastfeeding, and you are using the latest technology to help kids with that problem. Tell me a little bit about that.
Right, yeah. You know, a lot of new moms and second and third time moms, they come in and like either the new moms are like, we're just not able to breastfeed quite right. We have a lot of lactation consultants that we work with that refer our patients here, but we can see the babies like as soon as they leave the hospital. They come in, if they're not latching well and getting a good latch and the mom's having pain or discomfort, a lot of clicking and sounds, then we'll evaluate. If there's a tight tissue on the lip or the tongue, then that just needs to be released. And it's a simple procedure. We just wrap the little babies up and we use a laser. We have a CO2 laser. It's really quick. Very short. It's like a 2-minute procedure, and then they go right back to moms and they latch on, and a lot of times it's immediate difference in the way that latch feels and the way the baby eats, and they go to gaining weight and stuff that they were struggling with initially.
Right, and that's one of the things too, is you not just treat the patient, but you treat the family as a whole. So when patients come in here, when kids come in here, they truly become family here, right?
Right, yeah. I mean, there's been so many situations where the moms have come in with their little newborns and they can't latch and they're not gaining weight, and it's so frustrating for the mom, and we get the babies fixed and then the whole family ends up coming. So it's a lot of fun. We interact with the parents and the kids, and it's a family affair when they come in, really.
And I'm sure it's fun for you to be able to see these kids grow up as well, right?
Oh, it is. Yes, I have an office in Morristown. I've been there for 7 years, and every time they come in, I'm like, oh, you've grown up so much, and they just get so big, it makes me sad.
Yeah.
But yeah, we enjoy watching them grow up and being a part of their life. Yeah.
And so what are some of the benefits of being a patient here?
Well, it's fun. They come in and we have all the games and interactive stuff. All new patients get a t-shirt, and they always get a token to shop in our toy tower. They remember the cavity-free club if they have no cavities, and we do a drawing once a month. And usually we do some kind of gift card or some kind of gift for them. We have Lexie, our therapy dog, so they get to play with Lexie. That's always a bonus. And we do patient appreciation events, usually once or twice a year. This past year we did one at Chick-fil-A. They got to eat their free one night. So we try to do activities and keep the family involved and make it like a family, you know, I don't know, an event or some sort.
Yeah, exactly. Make it a fun going out, right?
Yeah,
Rather than maybe something that a lot of kids maybe dread. It's something that they can look forward to.
Well, we want them to like see us out in the community too, not just when they walk in the door. So, you know, when they see us out and we're sponsoring events, then they recognize us, and it's fun because they're like, oh, that's my dentist.
Yeah.
So, you know, if they know us and they become comfortable with us, then coming to have their teeth cleaned or having a filling done is not a big deal at all.
Right. It's like getting it done by a friend, right?
That's right.
Exactly. I love it. So you mentioned Lexie.
Yes.
Lexie's been so great because she's been at our feet actually this entire interview, just laying down, just hanging out, grabbing a quick nap.
Yes.
Tell me a little bit about Lexie, and the patients love her here, right?
Yes, yes. Lexie is a Australian Labradoodle. She's a medium breed, so she's around around 50 pounds. She's been with us for about a year and a half. So we had her trained. We did a therapy dog training session or series with her, and she just walks around the office. She usually stays with me, and she'll come in and greet the patients if they're nervous or scared, and she'll sit beside them. And who doesn't like a puppy dog? It usually makes the experience a lot easier for them.
And you use her as well for maybe people that are really anxious, or maybe kids with special needs too.
Yeah. If they're starting to get upset or scared, it's almost like a sixth sense to her. She'll come over and sit down, and they pet her, and we try to let them just sit there and play with her and kind of calm down, and then we'll kind of start over and try again. And sometimes we use her as a reward. If you're really good, then you can go feed Lexie a treat. So that works too.
So it works in her favor then as well.
Sometimes we bribe with her a little bit.
I love that. And you all are accepting new patients right now, right?
Yes, for sure. Yes, we're accepting new patients. There's someone here Monday through Friday, usually to answer the phone to get an appointment scheduled. So give us a call, and we're happy to get them taken care of.
Wonderful. Well, Dr. Helderman, thank you so much for having daytime here. It's been a pleasure talking with you.
Thanks for coming. We've enjoyed it.
Yeah, so make sure you give Kingsport Pediatric Dentistry a call. Set up a time to come meet Dr. Helderman yourself and meet Lexie. You won't want to miss it. Their number and their address is right there on your screen.